All right, it is March and it is Colon Cancer Awareness Month. Colorectal cancer, third most common cancer worldwide, the second leading cause of cancer-related deaths globally. Now, the risk increases with age, but there's also been an increase in cases among younger people. Why is that? This morning, Dr. Claire Peeples, colon and rectal surgeon with Corewell Health, is here to talk about many things, but let's just talk about this age disparity and also what we can all be doing maybe to cut our risks. Dr. Peeples, thank you for being here.
Thank you for having me.
So let's talk about what you're seeing when it comes to younger, and I know you've had younger patients kind of shockingly come in with colon cancer. What's going on?
Yeah, we don't really know. I mean, we're, still studies are looking into this, but it is shocking and scary for clinicians. We're seeing now recently in the last couple of years, the screening age has been lowered to 45, so that's a response to this trend that we're seeing. But yeah, I mean, I think we are seeing a lot more young people, even younger than 45.
That's what I was going to ask you, doctor. When you say young people getting colon cancer, what are you talking about? What age groups seem to be at greater risk?
Well, they are showing that the 29 to 40 range by 2030. I mean, it's skyrocketing. I think we're good we're relatively good with the screening with the older population after 50, because it's commonly known to get your colonoscopy and do the screening after that. But the younger population, there's a big disparity in that, and that's what we're seeing, the rise.
So what do you tell young people, because they don't fit into that criteria for colonoscopy or other screenings, right? Unless there's certain family risks, I guess.
Right.
So how do they protect themselves?
So I think the biggest thing is that in this population, if you're not 45 and not able to get your colonoscopy or not covered to get your colonoscopy, to seek out a doctor if you're having any symptoms at all, changes in bowel habits or bleeding. It's very important to discuss these findings with your physician and potentially consider getting a colonoscopy.
Is there anything that links these younger patients that you say, if you are, maybe it's obesity, maybe it's a sedentary lifestyle, maybe it's a diet that's not real healthy? Are those factors that are raising their risk?
We think that there could be some sort of correlation. I mean, we are seeing a higher risk of higher incidence of obesity in younger people, sedentary lifestyle, not as much exercise because we have increased screen use and TV watching and things. Diet, definitely the foods, less fruits and vegetables and things. But I mean, I do see patients that are healthy and exercise and they still have this colon cancer that arises. So
let's just talk about the anatomy of colon cancer. So it starts as a polyp, right?
Correct.
Inside your colon.
Yeah.
And then with the colonoscopy, which is still considered the gold standard for screening.
Exactly.
So the colonoscopy can go up and grab that polyp and get rid of it before it develops into cancer.
Correct, yeah.
Okay, let's talk about some other screening methods. What about the Cologuard, where you send in a sample? So the
Cologuard is probably the next best test. It's a stool sample, and yeah, so they send you the kit, and then you send your sample of your stool in. They check for DNA and blood in the stool. It is pretty sensitive, meaning that if you have cancer, it will likely detect it. However, the problem is there are some false positives and false negatives. So, if you get a negative test, you still could have cancer, and it's not as good as a colonoscopy for finding polyps.
Okay. Real quick, I know we got to go. For people who are leaving us now and won't join us in the next hour, what can you do right now today to protect yourself against colon cancer?
Well, definitely the diet. So high fruits and vegetables. Fiber is a very important supplement to take in your diet. So high fiber diets, fiber supplement, exercise, all the good things, low alcohol, avoiding smoking. Yeah. And then any symptoms that you have, make sure you're up on your screen. But if you have symptoms of bleeding or changes in bowel habits, talk to your doctor.
Yeah, don't be embarrassed to talk about that, because that is your body giving you a big red flag. Doctor, thank you, Dr. Peeples.
Thank you.
Trying to talk fast. We'll see you next hour.
Thank you.
Okay. Okay, here's the big question. How can you protect yourself from one of the most deadly cancers? We're talking about colon cancer. Dr. Claire Peeples, colon and rectal surgeon with Corewell Health, is here with some answers for us. Thank you, doctor, for sticking around.
Thank you for having me.
The first thing I wanted to ask you, and I want to throw up a picture of what the colon is, just a diagram of what the colon looks like inside our body. I know it's about 5 feet long, right? So there you see it. It's the outlining area. What exactly does it do? It plays a really important role, obviously.
Yeah, so the colon mostly absorbs water and some other nutrients too, but yeah, mostly absorbing water and to help firm up the stool.
And as part of the challenge, since you're a surgeon and you're in this area all the time, is part of the challenge that it's so, first of all, it's huge, it's 5 feet, and also it's got a lot of nooks and crannies, right?
Yes.
Is that part of the challenge of detecting cancer? Is that why cancer grows maybe in this area?
Yeah, yeah, the nooks and crannies, I guess the surface area, that's why it has those nooks and crannies to absorb the water and the nutrients. But yeah, I mean, I think the colonoscopies, they can miss the little polyps and stuff like that, you know, can hide in these little nooks and crannies. But.
Okay, so let's talk about colonoscopy, because I know you'll say that that is really the gold standard for screening, because you are winding your way through this pretty large area, and that's exactly what you're looking for with the camera, right?
Exactly, yeah. The little polyps that we can remove to prevent those from forming into cancer later on.
Okay, so colonoscopy, that starts in general at the age of 45?
45 is the new recommendation, correct.
Okay. Let's talk about some other screening options, because you've got the stool test, which people are a little uncomfortable with, but if you're too uncomfortable with getting a colonoscopy, the stool test is the next go-to, right?
Yeah, and it shouldn't be uncomfortable. It's in the privacy of your own home. They send you the kit. It's easy to do, and you just send it out. So it is easy to do. It's a pretty good test.
And what age do you do the stool test? Same?
That's the same age. Yeah, okay. Typically, insurance companies cover that nowadays.
Okay. Yeah, it's really all about what the insurance company will agree to cover.
Yes.
And in general, that's at 45 years old. And then the third test that we were discussing is this blood test.
Yes. Yeah.
And that would be your least favorite of the three, right?
Correct. I mean, if you're not gonna do anything, at least do the blood test. You know, some sort of testing. But yes, that does have a lower chance of detecting a cancer if you have it.
One of the big messages is with your diet, you might be able to lower your risk of colon cancer.
Correct.
What are you looking to eat, and what are you looking to avoid?
So, you know, obviously avoiding all the things that we sometimes like to indulge in, like alcohol, smoking, but
processed foods,
red meat, and like things like bacon, processed meats have been shown to have a higher incidence of colon cancer.
And do we know why that is? Is it something about the way it's digested in your body?
This could be because it's affecting the microbiome, which is a community of bacteria and viruses in our gut. So yeah.
Okay, so we're showing some fiber right now, because I know you want us to get more fiber. We all, it seems like, well, I don't know if all, but many of us are not getting enough fiber. That is something that helps lead to a healthy microbiome.
Correct.
So how much fiber do we need to get? And is that something we could start doing today to lower our risk of colon cancer?
Yeah, it definitely is something you can start today. There's obviously a lot of fiber supplements on the shelves that you can start with, but the best way to get the fiber is through diet, you know, like oatmeals and beans and lentils and things like that. But yes, we usually recommend 25 to 35 grams to start, but start low. Don't go out and start eating 35 grams, because it can lead to bloating and discomfort. So
yeah, I bought some fiber supplements, and I was like, whoa, wait a minute. So you do have to maybe work your way up, and when you start reading the labels, it seems kind of hard to get to 25 grams, or you want 35 grams.
Yeah, it is hard. I think in our Western diets and our processed foods and things, I think they do take a lot of fiber out of our food. So read the label, add in a supplement if you can. Yeah.
Good stuff. And the more salads you're eating and apples and those sorts of things, that's going to help you naturally boost your fiber.
Yeah.
Dr. Peeples, thank you so much.
Thank you.